Welcome to This Explainer. Look, if you've ever felt totally overwhelmed by a sudden physical setback, you are absolutely in the right place. Today, we're going to act as your personal guide to demystify exactly what physical therapy is, how it works, and most importantly, how it can help you get back to feeling like yourself again. We're going to break down this entire journey from start to finish to clearly map out your path to recovery. These questions probably feel incredibly familiar. Experiencing an injury or acute pain for the very first time brings on this massive, intense wave of confusion and anxiety. Suddenly, you're stuck asking yourself, okay, how bad is this really? And how on earth do I make this pain stop? I want to completely validate that right now. That panic, it's totally natural. Physical therapists see patients every single day who walk through their clinic doors needing help figuring out the answers to those exact questions. So here's our roadmap for today's explainer. First, facing pain and injury. Second, meeting your movement expert. Third, tailoring your treatment plan. Fourth, building trust and easing anxiety. And fifth, achieving daily functional goals. Let's dive right into section 1, facing pain and injury. What's really fascinating here is the sheer scope of who actually needs physical therapy. Seriously, there's no standard patient. Therapists treat a massive range of unique individuals every single day. We're talking about people recovering from simple ankle sprains all the way to folks undergoing really intense rehabilitation as stroke survivors. You could literally be sitting in the waiting room next to a marathon runner or a grandparent who's just trying to keep up with their grandkids. So if you're a first-time patient, just know that whatever limitation you're facing, they've seen it and they've helped someone through it. So what is it exactly? Well, physical therapy is basically a medical treatment used to promote, maintain, or restore health. And it does this through 3 core pillars: movement, hands-on care, and patient education. At its core, it addresses any limitations in your day-to-day life or movement dysfunctions caused by an injury. It's definitely not just some quick fix. It's a deeply comprehensive medical approach to restoring your body's natural capabilities. Moving right along to section 2, meeting your movement expert. Becoming a physical therapist isn't just some quick weekend certification. No way. It is a highly rigorous, demanding, multi-step process. First, it begins with a 4-year bachelor's degree. Step 2 is getting into and completing a doctorate of physical therapy program, which takes about 3 extra years. Step 3, they have to pass a massive national board exam. Step 4 is getting their actual state license. And it doesn't even stop there. Step 5 requires yearly continuing education just to maintain that license. So the big takeaway here, when you walk into a clinic for the first time, you are in highly expert hands. You're seeing a true doctor of physical therapy. Which brings us to section 3, tailoring your treatment plan. We're all pretty used to that generic medical routine, right? The classic take 2 of these and rest approach. But physical therapy is entirely different. You aren't getting a cookie-cutter worksheet here. Your physical therapist evaluates your specific medical history. They watch exactly how you naturally move, and they pinpoint specifically what hurts. They take all of this incredibly detailed data to properly diagnose your unique movement dysfunction. Once they've nailed down that diagnosis, they take the findings from your clinical evaluation and combine them directly with your personal recovery goals. The result? An all-encompassing plan of care that's tailored entirely to you. Their whole mission is to design a specific blueprint to get you back to pain-free everyday living. It's essentially a bespoke health plan designed specifically for your body and your life. All right, let's shift gears to section 4, building trust and easing anxiety. Physical therapy is such a unique health profession because of the sheer amount of time you spend with your provider. I mean, think about it. You're getting one-on-one time with your therapist multiple days a week. During this time, they really act as your partner. They help you create shared goals. And this frequent, dedicated time allows them to help you gain confidence and actively manage those deep anxieties you had back when your injury first happened. By building a genuine bond and true trust with your therapist, the mental aspect of your injury is managed right alongside the physical, which almost always leads to a much more positive overall outcome. Finally, let's look at section 5, achieving daily functional goals. You're going to hear your therapist use an industry term quite a bit called functional movement. Simply put, functional movement is just what you do every single day. It could be walking, sitting at your desk, or standing for long periods of time. Whatever you routinely do, that's a functional movement. The ultimate goal isn't just to decrease your pain in a vacuum. It's about getting you back to performing these specific movements exactly how you want to move, completely pain-free. And especially for first-time patients, these recovery goals are usually incredibly grounded and relatable.
A successful treatment plan might literally just mean gaining the confidence to walk up your own stairs at home without the constant fear of falling. Or it might mean getting out of bed in the morning without that sharp, debilitating lower back pain. Maybe it's learning to run again after a really significant knee injury. These are the real, tangible victories that physical therapy aims to achieve.
But it gets even better because a truly great therapist's care extends way beyond the four walls of the clinic. To support your recovery, they're going to guide you through practical lifestyle changes you can implement immediately. We're talking tips on changing your desk ergonomics so you aren't severely straining your neck at work. It includes modifying your current exercise routine to protect your joints. They might even guide you on changing how you sleep at night to ensure your body is properly supported while it actually heals. Your recovery plan truly travels home with you. To wrap up our core explanation today, I'd love for you to consider this quote: improving human experience by improving movement. That brilliantly summarizes the ultimate, holistic mission of physical therapy. It's not just about fixing a joint or stretching a muscle, it's about giving you your life back so you can experience the world the exact way you are meant to. Which brings us to our final thought. After walking through this entire journey from that initial panic and anxiety to meeting a doctor at level expert to receiving a deeply tailored movement plan, you kind of have to ask yourself, is physical therapy the right method to help you feel better and reclaim your movement? If you're living with a physical limitation right now, could this customized, movement-based approach literally be the key to unlocking your own pain-free life? It's a real game changer, and understanding the care behind it is the very first step toward healing. Thank you so much for learning with us today.